primarily, between 15 and 30% is actually absorbed. It's widely distributed through the body, and it's excreted primarily unchanged. And its spectrum is for herpes viruses, so herpes simplex 1 and 2, varicella zoster, which is what?
Chickenpox.
Chickenpox, okay. Epstein-Barr syndrome, which is a herpes virus. Herpes virus B, simiae, and cytomegalovirus, which is a severe type of virus, which may be contracted by pregnant women, can be passed to a child, and there's actually danger of birth defects as well. And unfortunately, some of these viruses are becoming resistant to this drug because it's been around quite a while, so it's something that we have to watch for. There are some adverse reactions, but they're minimal, thank goodness, okay? Topically, it might cause burning or stinging. Orally administered headache is actually really quite common. 13% is quite common, actually. So CNS effects, GI effects. Parenterally, there may be like a localized skin reaction to it, but the adverse effects are quite minimal because it doesn't seem to insert itself into the healthy cells. So that's actually a really, really good thing. Okay. The dose for treatment of genital herpes, so this is where it would be taken orally, is 200 milligrams every 4 hours when the patient's awake, 5 times for 10 days, so they don't have to get up in the middle of the night. It's again not been shown to be effective against herpes labialis in topical, tablet, or capsule form, but it still seems to be marketed and prescribed for it, even though it's not to be, it's not supposed to be effective through studies. Okay, so this is the one you asked about, Abreva, the duconisol. It actually has been shown to decrease healing time by half a day. Half a day, okay? So we're talking about somebody who has a 10 to 14 day infection. But people that use it anecdotally will tell us that, it can be effective for them. It must be started within 12 hours of prodromal syndrome. If any of you or any of your friends or family tend to get these herpes lesions on their face, they feel usually a little bit of a tingling, and it should be started at that time. The fact that it's over the counter, if somebody starts it right away, that can be an advantage. I'm not sure, I should look that up. If there are studies that show if you start it like right away, if it has more of an effect than if you don't, I would imagine that it would. And it's known to reduce the duration of the lesions, and that's really about all we need to know about it. The next one is pencyclovir. It's available topically by prescription, and it's for lesions of the face and lips associated with primary and recurrent herpes. It reduces the duration and the pain of the lesions, so that might be considered because of that. And it also seems to remain in cells longer than acyclovir. So this might be something that would be used for the herpes simplex of the face rather than using the acyclovir. So this would be a more appropriate drug to use. The famciclovir, valciclovir are both the same in that they are prodrugs, okay? Does anybody remember what a prodrug is? What's the significance? Not active until what? Until what? Our body does what to it? Partially metabolizes it, okay? So prodrugs are taken into our body, they're partially metabolized, and then they have an active metabolite. Mostly we think about metabolites being inactive and getting out of our body, but some drugs that are prodrugs need some metabolism in order to get them to work. Okay? This is for treatment of recurrent episodes of genital herpes. So if someone's on this, that may be what they're on it for. And also for acute localized varicella zoster, okay? Somebody with chickenpox type infection, but it's not an overall infection. So they may be having this outbreak and they may be given this drug. There's also another drug called ganciclovir, and this is given IV for that severe infection I talked about, cytomegalovirus, okay? Retinitis in immunocompromised patients, that's of the eye. It's actually quite severe. The pictures of it, I don't know if you know this about me, but I have this eye thing. Like, if it's about the eyes, I'm squeamish. Like, I would rather have my gut cut open than have somebody put something in my eye. I don't know what it is. So I've seen pictures of this, and it's quite horrible to look at. But this is something that happens to people, the cytomegalovirus that settles in their eye. It can cause flu-like symptoms, but most healthy people do fight this. For immunocompromised people, they may get something like this. So we're going to talk a little bit about how viruses work. Why are they so hard to kill and to get rid of? They're not actually alive, and they don't have their own genetic material in order to allow them to replicate. They have to get into the cell to do this, okay? They're so insidious, okay? DNA viruses use DNA for their genetic material and to replicate. RNA viruses use RNA. And retroviruses, which we're going to talk about, use RNA for their genetic material. So what they do is they use an enzyme, okay? So this would be, if we're talking about a retrovirus like the HIV, human immunodeficiency virus. For some reason I couldn't think of the word human before. And they make a DNA copy of their RNA by inserting itself into the host, into the person, okay, or the animal's cell genome. And they subvert the cell machinery, they take it over, they make new viral DNA and proteins, and they use the inserted DNA to copy themselves as the template. So there's a copy paste. Okay, there I go, there I go, there I go, there I go, there I go. And they do this very, very rapidly. So I was actually thinking about this and teaching it to you. I'm thinking, how can I think of a fun way to, to have you remember this? So this is what viruses do in cells. Okay, this is what viruses do in cells. So they take your cell phone and they hijack it and they take a picture, they take a selfie of themselves. Okay, so there's the virus, and then they do it again, and they do it again, and they do it again, and they do it again. That's basically what they do. They take over your cell and they start making copies of themselves. That's what they do. Isn't that fun? I actually emailed that to a friend of mine because I thought it was so much fun last night. And I have this completely wonderful, awesome video for you, but the internet does not seem to be working today. I'm going to try one more time to see if it's working on here. I don't know why it's not working today. You're not connected to the internet. It's not connected to my office. I don't know. I will post this for you. It is funny. It's a great, great illustration of how viruses replicate. And it will really illustrate what it is that we've just talked about. But it's very, very cool. Okay? But in the meanwhile, you can remember all the selfies of the virus. Okay? So it's just in there replicating, just at an amazing speed, and sometimes changing itself and replicating. So it's a wild thing to try and get control of. All right. Okay. So in talking about, let me just switch to my, able to see what I'm doing here. In talking about AIDS syndrome, we know that this is a disease that is produced by the retrovirus HIV, okay? Opportunistic infections, because I've already talked about people being immunocompromised from HIV or AIDS, okay? Opportunistic infections in these people are common. They don't have the defenses to fight them, okay? It might be bacterial, it might be fungal, it might be viral, okay? They take these people's bodies over because they can't fight them, okay? And there are many, many oral manifestations associated with this. You can also expect someone who is being treated for HIV/AIDS to be taking various anti-infective agents, and we may also be prescribing them for them, okay? And they may have other opportunistic diseases, including some types of cancer, as well as pneumocystic carinii pneumonia, really horrible and can be fatal, herpes infections, candida infections, all kinds of things. So generally speaking, people that have AIDS already at this point, the manifestations of HIV, they are taking a variety of different agents that have different effects on the viruses in order to keep them in check. And they take what they call, this is the technical word for it, a cocktail of viruses. Makes it seem like a little bit more fun, but it's definitely not fun. And the patients with AIDS that I have encountered are usually very well informed about their drugs and of themselves. They're very well educated about it. And we do encounter, I know I used to take the students out on several of the different public health rotations, clinical rotations, where we're actually performing, doing their dental hygiene care. And we did have some places that we went that had large populations of people who were HIV infected. And they had their laundry list of drugs that they were taking, and they knew what they were for and when they took it, and it pretty much ruled their lives. But you know what? People are now living with AIDS that were given a death sentence before, so it's really quite remarkable. But they are given a variety, a host of different types of drugs. These are the 5 different types. You should be familiar with the types and basically what they do. And we find that the combination of the drugs works synergistically because they have different mechanisms of action, okay? So they attack the viruses in different ways. And also using less of one type of drug and using other ones, what do you think that does about adverse effects?
Changes.
Minimizes them, okay? So if one causes this adverse effect, you give less of a dose and you give another drug that has this kind of effect and an adverse effect, so they kind of balance each other out. There are still a lot of adverse effects, but it keeps them in check, okay? Less severe adverse effects. Kind of like when we gave the little bit of the opioid with the NSAID, those combinations are done both so that they might work synergistically, the two work better together, okay, by working in a different, with a different mechanism of action, and we minimize the adverse effects by giving smaller doses of each of them. So really important, okay? These medications change all the time. As I'm putting together the presentation for you, I always go and I look up the new stuff and I think, oh my God, there's just so much more that's coming out. And if there's something really important or really different, I usually share it with you as well. But there are frequent changes in medications, and this would be information you would be looking up. So looking at the very first group of drugs, there's going to be the nucleoside reverse transcriptase inhibitors, okay? And these are called NRTIs. And the most important of these that I want you to know is zidovudine, and the common name for it is AZT. One of the brand names is also Retrovir. It's incorporated into the DNA polymerase, if you will, so that the synthesis of the viral DNA is terminated. So when that animal is in there with your cell phone and your cell making a copy of itself, it stops it cold, okay? It stops it cold. The drug has 100% times affinity for the virus, meaning what? If something has an affinity for the virus,
Nothing else will bind to it. It competitively binds to that, not letting anything else bind to it. The receptor.
It can competitively bind to it. It just has, rather than competitively, it has more of an affinity for it, but it's that same idea. Absolutely, that same idea. It has an affinity for the virus rather than the host. Again, do we want this drug going in and messing with the DNA in our healthy cells? Absolutely not. It's going to go in and mess with the DNA in the cells that are affected, okay? It's well absorbed orally, metabolized by the liver, excreted by the kidneys. That's a pretty normal thing. And it's distributed well to most body tissue, which is good because this virus affects many, many parts of the body. So it basically inhibits the synthesis of this virus by getting in there and cutting off its ability to replicate itself. It has significantly reduced the morbidity and the mortality of AIDS. Okay, mortality means reduced death. Morbidity means better quality of life. Okay, it's also given to someone who's exposed to HIV or to babies who are born to mothers that are infected with HIV. Really, really important drug. So this is a drug I want you to know about. It can cause bone marrow depression. Okay, and so people that are on this drug for a period of time may be required to occasionally have blood transfusions. The CNS effects are headache, agitation, and insomnia. Again, this is one of those things, significant effects, but risk versus benefit, living longer, killing the virus. People will complain about having bad taste in their mouth, changed taste in their mouth. You may see tongue edema. You may see bleeding gums, mouth ulcerations that are associated with this. Drug interactions, look at the drugs that it interacts with. A couple of NSAIDs. Indomethacin, acetaminophen, a really common drug, okay? Aspirin can inhibit AZT's gluconidation. What does that mean? It's metabolism, when it's being changed to get rid of in the kidneys. So because it inhibits this, it keeps it in the body longer, okay? So it would increase the toxicity of both aspirin and the drug itself. So you would want to exert extreme caution with taking aspirin, or their doctor would need to control for the dose since both are going to be having more of an effect, right? So I'm just making this up. Maybe somebody's on a baby aspirin, maybe they're going to take it every other day instead of every day. I don't know. But the doctor's going to look at that and control for those factors because people have to be on this. Confusingly enough, There's non-nucleoside reverse transcriptase inhibitors, NNTRIs, okay? That's the next group of drugs. And this is specific for HSV1, okay, which is the most common strain. It is used with other agents. Almost all of these are used with other agents. And this is used specifically, this drug, to prevent HIV transmission from the mother to the fetus, okay, at birth. Really important. So a woman's pregnant, she's HIV infected, HIV positive, this would be given to her to prevent the transmission, and the other drug may be given to the baby. It may lower this transmission at that period of time by 50%. This is amazing. These drugs are miraculous. Nothing short of miraculous, okay? And the HIV may have been contracted during the pregnancy, so if we know that, we then control for it by giving this drug. It inhibits the same nucleoside analogs, but it doesn't require bioactivation, so I guess it has a better mechanism of action and it works. There are some adverse effects, CNS effects we talked about, rash, GI, elevated liver function, so we would just have to test for that. But do you agree that you would have to put up with those types of adverse effects because of the benefit that you can see with it? Our third group of drugs is the protease inhibitors, and sequinavir is the drug I want you to know. 1, 2, 3 of these drugs, I want you to know them, okay? And I have a list at the end, and I've highlighted the ones I want you to know. This actually prevents the HIV cells from becoming mature, okay? And in the reverse transcriptase process. So it prevents the cell from fully becoming able to replicate itself. It can interfere with the action of the HIV cells where the previous drugs did not, okay? They affected the virus, but they didn't have an effect on killing off the cells. These can. So do you see why you might use more than one drug? Okay? This would be why. Okay? This particular drug on its own has significantly decreased morbidity and mortality of AIDS patients. So as they added this drug to one of the cocktails, they saw a reduction in AIDS sickness and death. There are some adverse reactions, as seen here, rash, lowering of blood sugar, paresthesia, so areas of the body that may become numb, GI reactions, oral buccal mucosal ulcerations is something you might expect to see, okay? This is one of the drugs that interacts with ketoconazole, so the ketoconazole may actually increase its level, okay? It would increase the level of the protease inhibitor. So this would be one that the doctor would need to control for dose because of that. All right. Remember that HIV patients might be on some of these antiviral, other antiviral and other antifungal, in this case, medications, right? Because they are opportunistic infections. So this may be an issue. So if they're in the dental office and we're recommending ketoconazole, we need to anything we put an AIDS patient on, even acetaminophen, okay? We need to contact the doctor and make sure that it's safe for them. Really, really important. We do not want to mess with their drugs working, okay? Or working too much. The fourth class is called fusion or entry inhibitors, and they block the progression of HIV infections to AIDS, okay? Really significant. They block the fusion or entry of an HIV virus, okay, into a human cell. So they prevent it from actually getting into the cell. When you watch that video, I love that video. When you watch that video of the virus getting into the cell, you're gonna be like, ew. I mean, it's like amazing what these things do. And you're gonna be very grateful for your own body that has this wonderful immune system, I'll tell you, okay? So blocking replication by blocking the virus from actually even getting into the cell. It's amazing, okay? So this is, again, one of those drugs that may be used in combination with the others as a cocktail. There are a couple of different types listed here. I'm not making you memorize them, but they do have a few adverse effects that are associated with them, but definitely one of the ones that would be added into the cocktail would be one of these types of drugs. Yeah?
They give that, like, they suspect that, like, accident, something happened, and they suspect that, like, my patient is, has an HIV, and somehow I punched myself and something, and I run into the hospital. Is that, they
I think it's one of the first ones that when there's exposure to it, I think it was the very first drug that might be given in that case. Yeah, prophylactically is someone who's been accidentally exposed to it.
That would be
This,
more for like.
yeah, this isn't one of the ones that I've heard of doing that, but I haven't read the whole thing about the drug. You'd have to look at the drug monograph for that. Remember with any of these drugs, if you're curious about them or you're